Hi, today we'll be looking at the rules of drug administration. So, pay attention as the lecture is being delivered, and don't forget to subscribe to this channel for more videos that will be helpful for your studies. Straight away, let's talk about the common size of route administration of these drugs, and we'll talk about why is it that it is important to take note of how the drug has to be administered, and why is it that we choose different sites. Why don't we administer drugs to the patient using one route? These are some of the questions that you have to be able to come up with answers at the end of this lesson. So mostly we've got the different routes of administration of the drugs. Can talk about the oral route, the experiential route, topical route, instillation and inhalation route, and others are not commonly used like rectal and vaginal routes. So let's straight away go direct to the route of the administration in details. But this is about the routes of administration that are going to use in terms of giving the drugs to the patient. So there are 6 errors that you need to take note of as you are giving the drugs in order to achieve the effectiveness of the drugs. Remember, each time we are giving drugs to the patient, there's an intended goal that we used to have. But in order for us to yield that intended goal fully, we need to follow these principal rules. First thing, you need to ensure that the person that you are giving this drug is the right patient who is supposed to receive this drug. Again, you need to ensure that you have the right drug, the right dose, the right route, right time, and right documentation. And according to the topic for today's discussion or this lecture, it is about the right route. Now, why is it that it is important to take note of the route of the administration? Quite alright, the drug is going to be introduced in the body, but if at all you use the different and wrong route, you are going to have adverse reactions to the drug, and you're not going to yield the intended goal. So these are some of the principal rules that you have to take note of as you are to give the drug to the patient. So we are saying that each time you prepare the drugs, you need to pay much attention on those 6 errors that we have talked about. And sometimes you find that the patient will have some questions about the drugs that you are to administer. So you must confirm any questionable orders that you are going to see on the drug chart. For example, the doctor will order the drug that has to be given to the person. Now, due to some errors that may be detected on the drug chart, before you go ahead with administration of that drug, you need to consult those questionable orders that are on the drug list. Again, the other thing that you need to take note of is the calculations. That's why there's a drug and the dose that you need to give the patient. So if at all you miscalculate, you are going to cause the adverse reaction to the patient. Hence, it is recommended and advisable for you as a nurse, as a medical personnel, to do calculations before you give the drug, because each and every person has a specific amount of the drug dose that has to receive. So you need to verify with your fellow medical staffs about the calculation of the drugs that you are to give before you even cite for the route of drug administration. If at all the person is having the questions, just like you have mentioned earlier on, you need to consult those questions and be able to give the adequate information. Answer the questions before you can go ahead with the drug administration of the patient. If you do that, you're going to be able to use the effective drug mechanism in the present. And you must also listen to the present, like for example, if it comes to the dosage, the drug regime, or the route. Sometimes you'll be given the information like, no, the previously I was giving this drug via IM or via IV, but why is it that now you want to give me this drug via oral? So all those kind of the questions have to be attended to, so that if there's a wrong act that has been committed, it has to be detected earlier and come up with the interventions that is going to combat the adverse reactions that are likely to occur due to the fact that the drug has been administered through the different and the wrong route. So what is going to help you to achieve the effective mechanism and effective drug administration. As you are doing your drug rounds, you have to pay attention to one task, which is administration of the drugs. But if you pay attention to other things, you engage yourself in other actions, you are talking to your phone, to your friends on phones, you are discussing something else, you are going to have what we call a drug error. But to avoid the drug errors, whereby you can give the drug through the wrong route, you need to ensure that you are paying much attention to the specific activity which is giving the drugs to the patient. If you do that, you are going to minimize committing the errors as you are giving the drugs. And we are saying that this drug error can occur if at all you administer the wrong drugs. Sometimes you may administer the wrong dose of the correct drug. Sometimes the dose will be okay, but the strength of that drug, because of dilution, you didn't pay attention to that, you give wrong dilution of the drug, which is going to lead to the drug error that you are talking about in this case. Or sometimes you may give the drug through the wrong route that we are talking about it in our today's lesson. So all those, they are going to lead to the drug error, and the drug error is what we are trying to avoid as medical practitioners. So in order to have all these that we are talking about, to yield the effective mechanism of the drug, to be competent in administration of drug, as a medical student, as a medical personnel, you have to be able to have the factual knowledge of what you are doing and the reason of what you are doing. You need to have a reason why to do what you are doing. By so doing, you'll be able to do what is right at the particular point in time. And you're saying that you should know the possible adverse reactions that they can come about in terms of the drug administration that you are giving. When you're giving the drug to the person, you have to be able to explain what is it that they would need to expect as side effects, or if at all there are drug adverse reactions that can be prevented by taking an action. You need to be able to do that so that you can prevent the occurrence of those adverse drug reactions that we do not want in this case. And he's saying that it is important to consider the drug history of this patient. You find that patients are different in terms of how they respond to the specific drugs. Sometimes they may find that they are allergic to the drug. Sometimes they'll give you the comments about what happened previously when they received this drug due to the conditions that they are presenting with. So before you go ahead with the administration of this drug, you need to take note of all those points and to take them into consideration so that you can know which action to take in order to prevent the adverse reaction that may worsen the condition or lead to another condition that may call for special attention. So sometimes you find that in situations that are going to require you to withhold the drug, just like we have mentioned, if the patient is having the history of having adverse reactions when you receive that drug, you are going to withhold the drug and not going to go ahead with administration of that drug, not until the further research is done. But it's not all complaints that are going to make you withhold the drug, because it is believed that all drugs have got side effects. Hence, it is acceptable to have some sort of side effects whilst the positive action that this drug is going to yield in this patient subsides that side effects. But there's those issues which are going to make you to withhold the drug and you're not going to go ahead with the administration of the drug. What are those kind of effects that we're talking about? For example, you find that there are problems that arise with an association to the drug when it was given. For example, the patient manifested with nausea, dizziness, ringing of the ears, and the difficulty walking. This adverse reaction may show that there is a special attention that has to be given to this drug before it is administered to this patient. Hence, you need to withhold the drug not until you do the further research about what could it be that is causing that problem. Sometimes you may be given the the information from the patient about the adverse reactions that happened when she or he received this drug. So before you go ahead, you need to withhold the drug. Sometimes you find that you must withhold the drug until reference are consulted and the primary caregiver, the doctor who had ordered that prescription, it is also contacted and being consulted from about the mechanism of that drugs and the side effects that are being manifested with. So just like we have mentioned, you need to take note of the comments that are given by the patient before you can go ahead with the administration of the drug. So a change in the patient's condition, a change in one or more vital signs or the appearance of the new symptoms, it is going to make you withhold the drugs before you can continue, because sometimes you may just worsen the conditions that was about to be managed, but due to the fact that you didn't pay much attention to the side effects or the comments that have been given by the patient have been considered. And sometimes with regards to what we are to discuss today, we are saying that depending on the drug being administered and the patient's diagnosis, these changes may indicate that the drug should be withheld and the primary caregiver should be contacted. More sometimes, if it is just about the route that has caused that, you need to find out about which other right route that you are to take in order to avoid the side effects, because other side effects of the drugs are going to be elicited just because of the problem or the wrong route that has been cited to give this drug from. Now let's straight away talk about the routes that we have talked about. We mentioned about the different routes that we are going to use in order for us to administer the drugs. Now what are these routes all about? We talked about the oral route. The oral route, actually it is administration of the drugs through the mouth of the patient, and the types of drugs that you are going to support the oral route administration are those that are in form of tablets, capsules, or sometimes liquids. These drugs are going to be given via the oral. And the administration of drugs is really easily for patients who are alert and can swallow. So these are contraindications that you need to take note of. The patient cannot be given oral drug when he or she is unconscious, when the patient can't swallow, when the patient is having the sores, the ulcerations, or the GIT, cannot be given the drug via oral, because we are trying to avoid worsening the condition. Hence we are saying that the oral drugs can be given to the patient who can able to swallow and who is fully conscious, because we don't want to block the airway and to support aspiration that can cause complications. So we are saying that when these drugs are ingested, they come in contact with the mucosal membrane and the digestive tract. That's why we are saying that there are drugs that are capable to be given via oral, because you find that other drugs, when they come in contact with the mucosal membrane, they are going to irritate mucosal membrane and causing inflammation. Hence we need to take note of all those accounts. And some drugs, these that are given via oral, they are coated with the substance that is easily dissolved, that can easily dissolve in the GIT, so as to produce its mechanism. So other drugs are not only being absorbed through the GIT to produce their mechanism, but after the digestion of the drugs by the aid of an enzyme P450, you find that these drugs are going to be absorbed in the bloodstream, and when they are introduced in the bloodstream, that's when now they are going to produce their mechanism. So we're saying that some drugs are designed for immediate action, some are delayed action, and some are prolonged action over a given period of time. So what determines this is the drug's solubility. So you find that if you want to produce the mechanism just now, you cannot give the drug that is having the long duration for its mechanism, but rather you need to be able to have the factual knowledge that we talked about earlier on, so as to be able to choose the drug that you are going to give through this oral route with an agility and the wisdom of administering that drug. As you're administering these drugs, there are some of the responsibilities that you as a medical personnel, as a nurse, being a student nurses or whatever the profession that you're doing, as a medical personnel, there are some of the responsibilities that we have to take note of. Sometimes you need to ensure that the patient, he or she is in upright position. Why are we saying that? Because the swallowing mechanism cannot be enhanced when the patient is lying down, but rather the Fowler's position is going to support the mechanism or the swallowing action or practice. And you need to ensure that the person is having all what he or she requires in order to swallow the drugs. For example, you need to have a glass of water so that it can support the swallowing of the drugs. And also you have to ensure that the patient is positioned, just like we have mentioned, it is supporting the mechanism of swallowing. So if at all the patient needs assistance for holding the drug into the mouth or the glass of water, support that, give that aid in order to enhance the full effectiveness of the drug mechanism. And you find that other patients may be having some disabilities in order to take drugs of themselves, and you need also to give advice to the patient first to take a sip of water so as to wet the mucosa, rather the GIT, so that the drug can have this the smooth flow through to the stomach, where the digestion is going to take place of that drug for it to be absorbed. If at all you just give the drug without advising the patient to take a sip of water, you find that it is going to promote the adherence. As it is passing through the GIT, it is going to adhere maybe in the esophagus, and it blocks the esophagus, and due to the prolonged stay within the mucosal membrane of the esophagus, you find that it is going to cause irritation, and inflammation is going to start at that time. So certain drugs can be given via oral when they are sublingual. It's not something that has to be swallowed, but rather it is placed just beneath the tongue for it to be absorbed in the blood vessels and to produce its mechanism. As a medical personnel, you need to advise the patient to avoid chewing or swallowing that drug, because it has to work just within the sublingual. That's where the dissolving mechanism it is going to take place. And here we've been given an example of nitroglycerin, which is commonly given as a sublingual, which is a vasodilator. So this sublingual, it can't be swallowed, because if it is swallowed, its mechanism is going to change, and we are likely to have the side effects or adverse reactions, because the drug has been given through the eye, through the route that is wrong. And here we've got a visual aid that is showing the drugs that are given via IM. So we can see this baby is given the drugs through the mouth to swallow, and in the visual aid down there, it is demonstrating how this drug it is going to go through the GIT through to the stomach. We move on. Apart from the oral route, we've got also what we call parental route. Parental route, in this case, we are dealing with the drugs that you are going to give through intramuscular, through subcutaneous, through intravenous, and through intradermal. So all these routes are falling under the parental route, and there are some of the routes that are frequent and often being used in the hospitals and the clinics to administer the drugs for some specific reason. And we are saying that most of these routes, they require special equipments in order for you to give these drugs, unlike it is with the oral route. Oral route is just a drug and the glass of water, the person will be able to swallow the drug. But in this case, you need the syringes, you need the needles, you need the swabs, you need the spirit to site the demarcation of the area that you are going to give this drug from. So that's why we're saying that it requires some special equipments. And we're saying that mostly the parental route, its absorption, its mechanism, it is quicker than that of the GIT, because mostly when you're giving this drug via parental route, it is just direct to the system, unlike it is with the GIT, where the drug has to be digested and be absorbed in the bloodstream. So in terms of the mechanism, you find that if you are to, what you want is the drug to work just there and then. You're not going to give the child oral route, but rather via the parental route. So we're saying that some of the reasons that are going to make you to go for parental route and rather than the GIT or rather than the oral route is that sometimes you find that other drugs can be destroyed as they are passing through the GIT due to the presence of the gastric acid. Sometimes it could be that that drug, it has the impact of imposing the adverse reaction on the mucosal membrane once it is absorbed. Hence, you are not going to give it via the oral, but via the parental. And the other routes like intralesion, whereby there's a lesion that has been formed in the body and then the doctor decides to give the drug just on the very lesion that has been accumulated. Sometimes it can be through intra-arterial. The drug is going to be introduced in the arteries, those that carries oxygenated blood to all parts of the body. Sometimes it could be intracardiac, where the drug is introduced just direct to the heart according to the mechanism that they want that drugs to work. Sometimes it could be intrathecal. Intrathecal, we're talking about in the spinal cord. You find that the drug is going to be introduced in the spine. Sometimes it could be intra-articular into the joints. So according to where the mechanism, the action it is needed at that particular point in time, that's where the drug it is going to be given through. Apart from that, we need to talk about your responsibilities as a medical personnel. Once you give this drug, it's not for all, but there are some observations that you need to take note of in order for you to achieve the effective use of the drug. For example, first thing, you need to wear protective equipments that are going to enhance you being prevented from contracting some indication of infections that can be contracted through the pricks and the other droplets that can be produced as you are giving these drugs. So you need to protect yourselves from the risks from infected blood and other droplets that may contain infections through accidents. So you need to wear the protective equipments like the gloves, and this has been approved and recommended by the Center of Disease Control and Prevention body. So after you select the site, remember we're talking about intramuscular or rather parental. After you select the site, you need to clean the area using the spirited swab or disinfectant, and disinfectant that is recommended by the hospital policy you are working with. Sometimes it could be the antiseptics. So you need to clean the area so as to avoid introducing all the microorganisms that are infectious in nature, pathogenic in nature inside the body, and it enhances or enables the effective treatment or therapeutic interventions that you are going to give to the patient. So we're saying that the one type of in parental route, it is intramuscular and it is abbreviated as IM. So this intramuscular route, it is administration of a drug direct into the muscles of the patient. And we are saying that most of these drugs that are given intramuscularly are quicker in terms of its action compared to that of the oral route. And we are saying that mostly with this intramuscular drug, what you need to take note of is that we give the dose which is about 1 to 3 mils. When the dose you are to give it is more than that, then you need to cite for 2 sites. Don't give all 5 mils, 6 mils at one site in order to achieve the effective absorption. So when it is given at one site, then it is going to alter its absorption mechanism, but rather you need to have another area where you are going to give this drug from. And we are saying that for IM, which is intramuscular, when you insert the needle for IM administration of the drug, you need to pull back the syringe barrel. to check for blood. If blood is present in that syringe barrel, then you shouldn't have to go ahead and give the drug, because remember, you're giving the drug to the muscles and not to the vessels or the blood. Hence, you need to withdraw the needle, you discard the drug, and you discard the needle in the sharp box together with a syringe in the clinical waste. Then you withdraw, you prepare another drug for administration. You cite another area, you do the same, you try to aspirate. If the drug is not appearing, then you can go ahead and give the drug to the muscles. And remember that when you're giving the intramuscular, the needle has to be at the angle of 90 degrees. Sometimes what matters is the thickness or the skin layer of the patient. Sometimes you find that 45 degrees of the needle, it is going to go for IM, but mostly we are saying that when you're dealing with the IM administration of the drug, ensure that the needle is at 90 degrees so that at least you can go far up to the layer of the muscle. And here we have already explained about the division of the dose if at all it exceeds 3 ml, so as to enhance the effective absorption of the drug. So we are saying that there are some sites that are applicable for intramuscular administration of the drug. You can talk about on the hips, on the arms, on the thigh. All those areas or the sites are applicable for you to give the drug via IM, because we've got the prominence of the muscles, so you can give that. And here we have seen the visual aid that is demonstrating how the needle has to be aligned as you are given the IM that is being given on the upper arm. So the needle has to be, you need to ensure that the needle is at the 90 degrees, just like we are able to see at this site. We move on. Let's talk about the intravenous administration. When you talk about intravenous administration of the drug, we're talking about giving the drug in the veins. So what are some of the things that you need to take note of? You need to ensure that you insert the needle, then you are going to withdraw the syringe barrel. When you withdraw the syringe barrel, you have to see the presence of blood, because you are to give the blood in the vein. So when there's a blood that is showing to backflow, then know that you are safe. You can go ahead with the administration of the blood or the drug in the veins. So after you give that, you find that other patients have got the bleeding tendencies. You need to ensure that you apply some pressure on it so as to promote the clotting of blood and the stoppage of the bleeding. So the intravenous route, it is given directly in the blood vessels, or rather in the veins, just like we have mentioned, and its action is almost immediate because it is introduced in the circulation so that the drug can be circulated all over the body. And you must ensure that the drugs that are administered via IV route are given slowly over 1 or more minutes. Why is it like this? Because the blood, it is to be taken back to the heart. Veins, they carry blood to the heart. So when the drug is just introduced at once, there's an onset or introducing or the blood or the drug in the blood, it is going to have a negative impact on the heart, which can even lead to cardiac arrest. Hence, you need to give it more slowly and slowly, so that at least you cannot alter the mechanism of the heart. And we have demonstrated what we are talking about when you say the intravenous. So this is how we do intravenous. So the needle, it is placed in the vein so that the drug can be circulated all over the vein. So we are saying that you can only give IV drugs rapidly if at all you are dealing with feedback infusions. There are those drugs that are going to be needed in the blood for just there and then, and mostly you are going to use the cannula and you insert the drug to run. So with that kind of the drug, it is going to run rapidly and not more slowly, just like we have mentioned earlier. So when you're using the Pittsburgh infusions, then you are going to let the drug to run more rapidly in order to enhance the rapid mechanism and actions that you want to give. Now, why is it that we are talking about all this drug administration? What could be the reason for us to take note of which site should we have to use to give the drug? Why not only to give the drugs via oral, just like we have mentioned that oral administration, it is easier and cheap. So we're saying that for sometimes it is to assure the rapid action of the drug. You want the action to be taken place just there and then it's an emergency. Hence you are not going to give the drug via oral, but rather you are going to give the drug via parenterally. Sometimes you are trying to prevent the drug from being destroyed by the gastric juices like hydrochloric acid we have mentioned earlier. You can't give the drug via oral because you don't want this drug to be altered or destroyed. You are going to give parenterally. Sometimes the patient is unconscious, can't able to swallow, or is vomiting. You can't give the drug via oral. Sometimes you want to prevent the irritation of the mucosa membrane, and sometimes the drugs are easily or are not absorbable well by the digestive tract. Hence you are going to choose for IM or IV or subcutaneous or just any other parental route. And we're saying that your responsibilities as you are giving the drugs via the parental route, you need to ensure that you administer the drugs that you have given. You document. Why is it important to document? We are trying to avoid the drug error, to give more dose to the patient, because sometimes you give, another medical personnel will come and find that the drug is not given, will also give the same drug, which is going to make an overdose to this patient and lead to adverse reactions. Hence, it is very much cardinal. It is part of the procedure to document the drug that has been given. So we're saying that you must complete this task as soon as possible, just as soon as you finish giving the drug. Before you leave the patient, ensure that you document the drug that you have given to the patient. We talked about the IM and IV. What about the subcutaneous route? The subcutaneous route is the giving of the drug in the fat tissue that is found just beneath the skin, in the subcutaneous tissue. So with this one, it is absorbed more slowly than it is with the intramuscular injection. But there are some drugs that can only be given via the subcutaneous tissue. For example, let's talk about insulin. You want to give insulin, that has to be absorbed slowly. We are not going to give it via IM, but rather in the subcutaneous tissue. We have also been given the heparin, two drugs most commonly given by the subcutaneous route. And we have demonstrated here what we mean when we say subcutaneous tissue. The needle has to go in the subcutaneous tissue, which is just the beneath layer of the skin. And for you to acquire that, to be able to give the drug via subcutaneous tissue, you need to ensure that the needle, it is about 45 degrees an angle, so as to ensure that the needle doesn't go beyond the subcutaneous tissue and being given into the muscle. What are your responsibilities? Mostly when you're giving the subcutaneous tissue, the dose, it has to be of 0.5 to 1 ml. If at all the dose exceeds that, then you are going to call for intramuscular, because the subcutaneous tissue, for it to absorb more effectively, it has to be given the dose which is within the range of 0.5 to 1 ml. But you find that there are those drugs that you cannot give via IM just because the dose is more than 1. What are you going to do? You are going to give on the separate site. The other one, on the right upper, the other one, you change the site of administration, and you shouldn't have to be giving the drugs just on the same site to avoid the tissue destruction. You need to keep on rotating the injection so that you avoid the destruction of the tissue, and also to enhance the effective absorption of the drug. However, to place the drug in subcutaneous tissue, so you need to select the needle length and angle of insertion based on the patient's body weight. So we're saying that patients, they are different. Others, they are thin, others, they are fat. So you need to ensure that you select the needle that is in line with the tissue that you are dealing with, or the body or the patient that you are dealing with, in order to give the drug in the subcutaneous tissue. And here we are talking about what you require in order for you to be able to ensure that you insert the drug or you administer the drugs in the subcutaneous tissue. So you find that if at all the patient is more fat, even 90 degrees angle, it is going to go in the subcutaneous tissue. But if it's thin, even 45, it can be in the muscle, but maybe you are going to reduce the angle, maybe 30 or 40 or so. And the needle, it has to be a smaller needle that is going to go in the muscle, like a 23 or 25 kg, which is close to a half of the needle. Then there's also other routes that you can administer the drugs, like the inhalation route. It is a site where you are going to give the drugs that works in the respiratory tract. For example, if there's a congestion in the respiratory tract, you are going to go for inhalation route, where the drug is going to be put maybe in a warm water, then the person is going to be advised to inhale. So this is what we are saying to be the inhalation, and they are mostly used to treat the conditions of the nose and throat and the lungs, just like we have mentioned in the respiratory tract. So other drugs that are given through inhalation, they could be having the local or the systemic effect. Sometimes it can be only confined to the affected area. If it is the throat, it's only the throat, but sometimes it is also being distributed to the circulatory system and become the systemic effect to the whole body. So this is what we were to deliver in this lecture for today. Remember, earlier on we mentioned number of routes that are more than what has been discussed. You can find other routes of administration in the lessons that we'll be having next time, but ensure that you have the factual knowledge on the routes that we use in terms of drug administration, just like we have mentioned in this case. So we talked about the oral route, we talked about the parental, and the topical route. When you're talking about the topical route, you're dealing with the drugs that are going to be applied just on the skin. When you're talking about inhalation route, you're talking about the drugs that are going to be instilled in form of the drops, like from in the ear. You're going to drop the drops of drug in the ear, or in the eyes, or in the mouth, all those things. Inhalation, we talked about this. So this is our end of today's lesson. Please don't forget to subscribe, like the video, give the comments, share with your friends, and subscribe for more videos that will be helpful for your study. Thank you very much for your time.